Doctor, please can you tell me about female infertility?
Female infertility is a condition where a woman is unable to conceive. It's a condition where a woman is infertile. If you are facing such a challenge, it is advisable both you and your partner book an appointment with your doctor to evaluate the cause of the problem. When you go to see your doctor, the doctor will perform the following tests. Number 1. Ovulation test. This test is a blood test done for progesterone, a hormone produced after ovulation. It is done to detect the surge in luteinase. Number 2. Hysterosalpogography. During this test, an X-ray contrast is injected into your body uterus. An X-ray is taken to check for the problem inside the uterus. The test also shows whether the fluid passes out of the uterus and spits out of your fallopian tubes. If any problem is found, you will likely need further evaluation. Number 3. Imaging test. This is done to look for uterine or fallopian tube disease using ultrasound. Number 4. Other hormonal tests can be done depending on your situation.
Is there any treatment for female infertility?
Infertility treatment depends on the cause, your age, how long you have been infertile, and personal preferences. Treatment can either attempt to restore fertility through medication or surgery, or help you get pregnant with sophisticated techniques. Here are some medications that regulate or stimulate ovulation. They are known as fertility drugs. Fertility drugs are the main treatment for women who are infertile due to ovulation disorder. Fertility drugs includes 1. Clomiphene citrate. This is taken by mouth. This drug stimulates ovulation by causing the pituitary gland to release more FSH and LH, which stimulate the growth of an ovarian follicle containing an egg. This is generally the first-line treatment for women younger than 39 who don't have PCOS. Number 2. Gonadotropin. This drug is injected into the body to stimulate the ovary to produce multiple eggs. It's also used to mature eggs and trigger their release at the time of ovulation. Number 3. Metformin. This drug is used when insulin resistance is known or suspected cause of infertility, usually in women with a diagnosis of PCOS. Metformin helps improve insulin resistance, which can improve the likelihood of ovulation. Number 4. Altrozole. Altrozole is usually used for women younger than 39 years who have PCOS. Number 5. Bromocriptin. Bromocriptin is used when ovulation problems are caused by excess production of prolactin.
What of the surgical means of treating this?
In some cases, surgery can be done to correct or improve female fertility. One of the surgery that can be done is laparoscopic or hysteroscopic surgery. This surgery is done to correct the problem with uterine anatomy, removing endometrial polyps and some type of fibroids that misshape the uterine cavity. The second surgery that can be done is tubal surgery. This surgery involves the removal of your tubes, or blocking the tubes close to the uterus, to help improve your chances of pregnancy with IVF. Number 1 risk of fertility drugs is pregnancy with multiples. Fertility drugs increases your chances of giving birth to twins or triplets. Oral medication carry a fairly low risk of multiples, less than 10%, while your chances increase up to 30% with injectable medications.
Wait, doctor. You mean, if I take fertility drugs, my chances of giving birth to twins or triplets will increase?
Yes. Fertility drugs stimulates the ovary to release multiple eggs. Generally, the more fetus you are carrying, the greater the risk of premature labor, low birth weight, and late developmental problems. Sometimes, if too many follicles develops, adjusting medications can lower the risk of multiples. Number 2. Ovarian hyperstimulation syndrome. OS. Injecting fertility drugs to induce ovulation can cause OS, which is rare. Signs and symptoms which includes swollen and painful ovaries. Usually go away without treatment and include mild abdominal pain, bloating, nausea, vomiting, and diarrhea. Number 3. Long-term risks of ovarian tumors. Most studies of women using fertility drugs suggest that there are few, if any, long-term risks. However, a few studies suggest women taking fertility drugs for 12 months or more, without a successful pregnancy, might be at increased risk of borderline ovarian tumors, late in life.
All right, Doc. It's nice talking with you.